thank you for giving up your time today to talk with us about, what is a really, really important issue, and that's aged care. And there's many commentators, of course, have described it as a massive failure of successive coalition governments and made a lot worse by this government. And I suppose all you've got to look for is the evidence that came out of the Royal Commission and all of those harrowing, traumatic sort of pieces of evidence that were presented during that. But once again, we should pay our respects to our elders past and present, of the people who are custodians of this land, the Darramurrugal and the Darug people. And they're people who sort of look after their old people in lots of ways, aren't they? Maybe we should learn from them. Right at the beginning, what we want to say really loudly and clearly, though, is that what we're about to talk about here and the crisis in aged care has got nothing to do with the incredible carers that are there every single day looking after these people. And if anyone has ever been inside an aged care home, then they will know the amazing, wonderful job that those people do. And they're really skilled professionals who really deserve a lot more credit and a lot more money as well for the sorts of things they do. Well, people have talked about the decline in standards and quality in aged care. When do you think that began?
Many commentators have said that the problem began when John Howard privatised aged care when he was minister in 1997.
Mm-hmm.
Up until that time, aged care was the responsibility of state governments.
Right.
Carers working in state government-run care homes then had to decide if they wanted to stay to work for private owners. Many of them left.
Right. And I actually have someone who's in our apartment block who was one of those people. She remembers it very sadly. So why was that change then so significant, do you think, going from state-owned aged care homes to privatising them?
Like anything that is privatised, the owners want to make a profit.
Mm-hmm.
Sometimes a profit motive, often also driven by shareholders, becomes more important than the quality of the care provided.
Right.
One carer commented to me the other day that was exactly the problem in the care business he worked in. All the owners care more about is the profit,
Mm-hmm.
not the quality of care for their residents. In addition, any sort of external regulation and accountability is very weak.
Yep.
So we saw evidence of this weakness during the COVID outbreak in some of our aged care
Aged
homes.
care, we certainly did. So what do you think were the main issues and the main problems that occurred during COVID? But not only during COVID, they're still occurring, aren't they?
They are. There are many, but let's highlight a couple of main ones. The first is that finally the government and health advisors have admitted there was no plan as the pandemic grew for
Right.
aged care. Minister Colbeck, as his various embarrassing public appearance demonstrated, was totally incompetent
You're
and
right.
missing in action.
Yep.
Some commentators have said that the attitude of the government was, these are old people, many have comorbidities, who are going to die soon anyway.
Right.
We can sacrifice the old to keep the young healthy.
Mm-hmm.
Now that sounds pretty shocking,
It does.
but it is reasonably well established that in the government agencies such as NDIS, decisions relate to the supply of services or expensive technology, especially for disabled, is pretty much an economic decision
Right.
based on a probability equation. Will this person live long enough to warrant the expense of providing what is required?
Exactly. Yeah.
There are numerous cases where people have died before the equipment has arrived.
Yeah.
So the notion of sacrificing those who will probably die anyway becomes more believable. for that greater good principle.
Right.
Of course, more than 1,700 people have died in aged care, the majority in the first 6 weeks of 2022.
Right.
When all of Morrison's strategy to deal with COVID was supposed to be in place. As numerous commentators, including those who wrote the Royal Commission into aged care, said, if the government had acted quickly to implement recommendations from the report presented more than a year ago,
Right.
there would not have been as many dying in 2022.
Yeah, that's exactly right. And but there was also a really big issue about vaccinations, wasn't there?
Yes. A major failure was the lack of planning and procurement and provision of vaccines to both residents and staff in aged care, nursing homes, and on aged care home packages. An even more critical issue was the lack of vaccines for the disabled and
Yep.
Indigenous people.
Yeah.
This critical mistake put aged care residents at incredible risk. It resulted in many carers and residents becoming infected with the virus, and any infections, and then the infection spread like
Yeah.
wildfire through the residents.
Yeah.
Added to this was a lack of supply of personal protective equipment, or supply of inadequate or faulty equipment, much of which had to come from overseas.
Yep.
Also, there was a lack of any preparation or training of staff in strategies to deal with an outbreak of the virus. For example, the first decision by management in some aged care residents where an outbreak occurred was to send all the staff home.
Oh, right. Yeah.
No one thought about
Yeah.
if everyone had gone home, who was going to provide
That's
the
right.
critical services of care?
Yeah.
Who was going to feed the residents?
Yeah.
And there was no one left in the residents who had a thorough knowledge of the care needs of residents, or even where the essential technology and equipment was, so that they could explain it to the emergency response teams when they came.
Yeah. Yeah.
So in a number of homes affected by a further management response, it was just close the shop,
Yeah.
refuse entry to family and loved ones,
Yeah.
but provide no communication or explanation as to what was happening.
Yeah.
This simply resulted in even greater and unnecessary anxiety and trauma, and really
Yeah.
open up for accusations of cover-up.
Particularly for the families. Yeah.
That's right.
Yeah. Okay.
So this lack of planning, strategic thinking and preparation took a long time to remedy, and by that time much anxiety, distress, trauma and disease had already been created, suffered by residents and carers. This was the beginning of an escalating problem that we are still dealing with today.
We certainly are. Yeah. And of course another big issue is a lack of staff. I mean, I spend a lot of time in aged care homes and there's just hardly anybody there. Why do you think that? What happened? Where did the staff go?
Where are they? Working conditions and salaries in aged care are pitiful. For example, registered nurses in aged care are paid less than those in public hospitals. Why? In many cases, their care is even more specialised and demanding. Personal carers, the ones that do the bulk of the attending to residents, are paid $23 an hour.
Wow.
I mean, that's less than you earn at Bunnings or Woolworths.
Bunnings or Woolworths, yeah.
The carers in aged care are doing some of the most demanding and important work in our society in incredibly challenging contexts. Only one has to spend a little time in aged care residence to witness the caring, loving support that carers play. If you've never been in an aged care home and spent some time, you can understand and appreciate the incredible work that those professionals do.
Yep. And of course, a number of them came from overseas, didn't they?
Yeah, many, especially from Asia and Pacific, and where they do value and care for the elderly as an important social responsibility. Many of these are not permanent residents of Australia, and so numbers of them had to return to their home countries as soon as the pandemic began in this country. And many have not been able to return because of border closures, and some will never return. Some workers in health-related professionals who lost their jobs because of the lockdown have become casual carers. Now that the economy has started to come back, they have returned to their previous jobs. So in addition, many of those working in aged care are highly skilled professionals, but they've gone to other jobs because they can get a much higher salary there and better working conditions. So, and some have even have caught COVID and are suffering still from long COVID and not being able to return to work.
Yeah. Well, I mean, what's really interesting is that recreation officers, for example, are some of the most important people of all in an aged care home, because they're the ones that are there, every single day trying to engage the residents in activities, whether they're learning activities, whether they're performances, music, whatever it might be. They're trying to buoy up their spirits and look after them, make them feel good about being where they are. And I mean, the other day, for example, I heard a story where this particular residency has had 8 recreation officers in 15 months. And of course, the other thing about it is that there's a whole issue with a lack of training of these people. We just don't have the numbers of people who are coming into aged care. Isn't that right?
That's right. It's a lack of planning. It's a lack of support. It's a lack of training that we are not building, and the resilience of a workforce in aged care. So I would say the most important changes necessary are staff and increasing their wages.
Right. But, I mean, I thought that Morrison actually established a Royal Commission into aged care to try and remedy some of the things that we're talking about. Isn't that right?
Yes, they did. The Royal Commission heard submissions over 2 years and presented its report at the beginning of 2021 with 148 recommendations. The evidence presented was harrowing. The tales of neglect, poor quality care, suffering, abuse, even inefficient and incompetent management of dying was unbelievable. The Morrison government finally accepted 126 of the 148 recommendations. They even had a 5-year plan, but they refused to accept 3 of what have been recognised by the writers of the report and other experts in aged care as maybe the most important of all.
So what are they?
There is a strong agreement that maybe the most important reason is not being able to attract staff is the poor wages.
Right.
The Commission recommended a rise in wages for all care workers.
That's right.
And the Morrison government should support such a case with the Fair Work Commission.
Mm-hmm.
The Health Services Union is pushing for a 25% increase from $23 to $29 an hour. The Morrison government and Minister Colbeck in particular have consistently refused to support the claim.
Yeah.
So recruiting more staff will continue to be just as difficult as if it had been previously. Already there are aged care homes closing, sometimes with no plan for where their residents will go.
That's right. Yep.
Because they have no staff.
Yep.
A second recommendation from the Commission was to establish an independent panel of experts in aged care to oversee and ensure that aged care quality of care and management were meeting regulations and standards. The Morrison government did not act on that. Instead, they simply reappointed for 3 years the government-appointed commissioner.
Yeah.
Evidence given to the commission would suggest this commissioner has not been able to ensure the standards and qualities that should be present in every aged care home.
Okay. So they're really 3 very significant recommendations that they've rejected.
Well, I haven't mentioned the third yet.
Okay.
Yeah. In addition, most of the $2.6 billion allocated from the 5-year budget and for spending to July 2022 was not allocated to support residents in aged care or staff. It was allocated to home care packages to support people in their homes. There are currently 53,000 people waiting for a home care package. That is 11,870 less because they had died before they received a package.
That's terrible.
Many of them from COVID because of the complete bungling of the vaccination of aged residents being supported in their homes by the health minister and his bureaucrats. Agency carers supporting these people were allowed to continue going into homes where neither they or the home residents were vaccinated.
So what do you think then are the biggest issues that you're going to fight for if you go to Canberra to do with aged care?
We've got to make the federal government take accountability and responsibility for everything relating to aged care that they assumed responsibility for during the John Howard ministry.
Exactly.
We need to appoint a minister for aged care who actually knows something about this portfolio and has the commitment to make significant changes.
Well, we certainly won't appoint Mr. Colbeck, will we?
No.
No.
We need to implement all 148 recommendations from the Royal Commission into aged care with a timetable of exact targets for completion of the implementation, reports on the target completion to Parliament annually. We need to immediately have an investigation with powers of a Royal Commission into the operation of the NDIS and its services to clients.
Absolutely. Yep.
And reform the operation of NDIS so that its decisions regarding provision of services is equitable and based on demonstrated needs and not economics.
Yep.
We need to immediately increase the wages of all aged care workers appropriate to their responsibility, but at least by 25%. We need to set a target and work towards having at least one qualified registered nurse in every aged care, 24 hours
That's for sure.
for 7 days a week.
Yep.
Establish as quickly as possible training programs for trainee aged care carers and workers, including specialist knowledge and care in disability and dementia and gerontology.
And we need a regulatory framework, don't we?
Yes.
We also need the regulatory framework, first of all, put into law so that it's actually legally enforceable. But then we also need someone who's going to actually make sure that the aged care homes and their owners actually perform to that regulatory framework.
That is absolutely critical. We need to establish an independent body of people with expertise in and experience in aged care, including aged care disability, to oversee the implementation of this regulatory framework and complete evaluations against the framework at least once in every 3 year period.
Yeah. And I mean, that will get rid of the self-regulation that's caused a lot of the problems that we've got at the moment if we have an independent peer panel that can do that. Well, look, there are certainly a lot of things that need addressing and that you're going to be working towards. So thank you so much for being here today. Is there something else you want to say?
No, I just say that we can do it. Our age is our most vulnerable. We need to protect them. We need to respect them. We need to give them the quality that they deserve.
Well, I think there is one more issue that we need to raise and make people aware of. That there are 176,000 people in aged care homes. If every one of those people voted, that would be the biggest voting bloc in Australia. But you and I know something about what the AEC has done this year, don't we?
Yes, very sadly, they are not going into aged care and they are not being able to vote. So they're actually being disenfranchised. So that is not such a good thing, is it? Because this is the most important issue affecting them and they actually have no rights to do that in a democracy.
Well, and I don't know how many Australians actually know that. So it's a very important issue that, again, we need to address. Thank you so much again for giving us your time today and for, trying to explain again what the most important things are that you're going to fight for if you're able to join the next government in Canberra. And we wish you really well in the rest of your campaign.
Authorised by Janine Kitson, Suite 1A, Level 2, 802 Pacific Highway, New South Wales, Gordon 2072.